Hi, y'all. Welcome back to the Future is Now Future Planning Workshop. And so this is our last and final video. If you have not had the chance to watch the first two videos, part one and part two, please go back and view those because they'll do kind of culminate and rely on each other. So in this last video, we're going to talk about who gets to keep the dream. We've been talking a lot about dreams, dream job, dream house. And so we really want to talk about who gets to help keep that dream. And then we're going to talk about finances because we know that a lot of this stuff costs money, and it really does. There is a financial aspect to a lot of this. And then we'll kind of culminate talking about that letter of intent that we talked about in the first video. That is kind of the product outcome of this workshop. So we're going to watch another video.
What is supported decision making? A message from Disability Rights Texas.
Hello, my name is Ricky Broussard, and I'm at Disability Rights Texas. I'm here to talk to you today about supported decision making.
Supported decision making is a way for people with disabilities to keep our rights and make our own choices with help from others instead of having a guardian who makes decisions for us. Guardianship.
People say guardians make it easier, but once you have a guardian, that guardian has control over you. A guardian is decided by a judge, and you do not have control over any important decisions that need to be made. It shouldn't be that way because it's about the individual's life. It's not about their life.
Under guardianship, you can lose the right to choose where you live, how you spend your money, who you spend your time with, and other important decisions. Supported decision making.
Supported decision making. It's all about the individual. It helps us make the right decision for ourselves in our life. If you need help making decisions, choose someone that you trust. It doesn't have to be a family member. It could be somebody at school you trust or somebody at work you trust. After you choose somebody to support you, you tell them what you need support on and how they can help you. Some of the things that your supporter can help you do is going to the grocery store or make medical decisions or with where you live, or they could help over your finances. In my support team, I let everybody know, okay, this is what I need decisions on, and this is what I need you to help me with. After I hear the pros and cons of the decision, that's when I make the final decision on whatever choice I make. We all need help to make decisions. We have to make decisions every day. Your rights should not be taken away just because you need help.
To learn more, ask for the free book called Making My Own Choices by calling 512-454-4816 or toll free at 800-252-9108 or by video phone toll free at 866-362-2851 or by visiting www.drtx.org/choices. This video was brought to you by Disability Rights Texas. Find us on the web at www.drtx.org. Financial support for this video is provided by the Texas Council for Developmental Disabilities, with federal funds made available by the U.S. Department of Health and Human Services Administration on Developmental Intellectual Disabilities. The views contained herein do not necessarily reflect the position or policy of the funding.
So that video just kind of touched on supported decision making, which is a newer thing. Texas was actually one of the first states to adopt it. So way to go, Texas, on that. So I'm just going to kind of talk through, and of course we acknowledge that this conversation can be a bit tricky because sometimes we are talking to people who already have some type of guardianship in place, but the disability community as a whole is trying to move away from full guardianship because it really does take away the autonomy of the person with disabilities. Um, and so we know in the past that that was kind of what the option was, and so we never want to diminish the fact that things have changed and that sometimes decisions were made for people and that we don't always have the option to go back and to go back on some of those decisions. But we really want to think about moving forward for people who are not the age of 18, what options exist right now. And Disability Rights Texas has a lot of really great information for anyone who needs more information about this. They probably are the people, I would say, right now in the state of Texas to go to about different options as far as guardianship and what that looks like. So I'm going to list out the guardianship options. And not everybody with a disability needs guardianship options. People are able to turn 18 and they don't need this support. Other people do. It just kind of once again depends on that individual, what their strengths and what their needs are. So in order of most restrictive to least restrictive, that's how I'm going to go through this list. So we talk about guardianship. And so guardianship is when an individual with a disability is not able to be their own guardian, is not able to make their own choices. And so they need somebody else to do that for them. And so there's two different options when we're talking about guardianship. There's full guardianship, which means that the individual with the disability is not allowed to make any of their own options. They're not allowed to vote. They're not pretty much allowed to do anything without the guardian. This is very limiting. It may be appropriate for a very small subset of the population, but probably what's going to be a better option for most people is something called limited guardianship, in which you kind of go through and you kind of talk about what areas the person needs help in. And it's not like a full blanket guardianship. It's a bit more limited in nature and kind of, it does allow the individual keeps their right to vote unless that is explicitly stated that they can't vote. And it does allow them a lot of different rights that they wouldn't have under a full guardianship. Guardianship is something that's done through the courts, and so it is a bit more expensive. It is a bit more lengthy of a process. So next we have power of attorney, which is kind of the step below guardianship. It helps the individual disabilities have a bit more control over the choices that are made on their behalf. And then someone is serving as the power of attorney to help make a lot of those bigger decisions. Medical power of attorney is talking about medical decisions. Representative payee, this may be an individual, it may in some places be an organization that is in charge of the financial aspects of a person with a disability, and so they would be the ones who a lot of times get their money, and then from there they decide. A lot of times they pay their rent, they pay all their bills, and then they're given kind of the leftover money to spend on their own. This may be something that works well for people who are living independently, but maybe don't have the skills to be able to budget well enough to make rent every month and to kind of pay those basic bills that need to be paid, and then kind of have money that is able to be spent to their own discretion. Supported decision-making agreement is something that was talked about in the video, and this is a relatively newer thing. It's very easy to enact. It's just a sheet of paper, and it allows the individual with a disability to say where they need help making decisions and who's allowed to help them make those decisions. This is a legally binding piece of paper, and it needs to be. It's very easy to do. You can find, like I said, all the information on Disability Rights Texas, or just Google supported decision-making agreements. And also it'll be in our resource guide. But this just, so say an individual needs help with financial decisions, so they can say, my brother will help me with financial decisions, and when it comes to medical decisions, my mom will be able to help me with that. A person with a disability needs to be able to communicate yes or no to be on a supported decision-making agreement. which most people do have that ability to communicate yes and no. And this also allows, a lot of times when a lot of these other options, it all falls down to one person or maybe sometimes two people, but supported decision-making agreements do allow you to spread that responsibility out into different individuals and play to their own strengths. Once again, always talking about those strengths, like we mentioned in part one. So maybe if you're looking at the person's circle of support and you see like, oh, this person who's in their inner circle, they are an accountant. And so they really have a good understanding of finances. So it would be good if they were able to help out the individual with their financial decisions. And so a lot of times, or maybe someone's in the medical field, so they understand medical things a bit better. So that just allows the responsibilities to be kind of divvied out a little bit, and also allows everyone to play to their strengths. And a lot of times we may find that adults with disabilities can end up in kind of vulnerable situations when they are put under guardianship, especially if the people that are making decisions on their behalf are not keeping the individual's best just needs at the heart of the decisions. And so being that I do work with the Texas Sibling Network, I just want to kind of touch on this. As far as siblings go, what should the siblings' role be when we're talking about guardianship? A lot of times we hear from siblings like, oh, I'm my brother's guardian if my parents pass away. But what does that mean? And is that a responsibility that you want and that is something that you're able to do? Adult siblings can play as big or as little of a role in their siblings' lives. We really think it's important to note that not every sibling plays the same role, and we should never expect siblings to be involved in their lives. Sometimes I hear parents come in with the assumption of, well, their sibling will help take care of them when I die. And my question to them always is, have you talked to them about that? Is that something that, and had a real conversation about what that looks like? And is that something that they're able to do? And a lot of times, sometimes it may be, some childhood trauma from growing up with a sibling with a disability, and it may not be realistic that they're going to be involved in their life. Other siblings take on a very big role in their siblings with a disability life. It really just depends on the individual. It can also depend on where they are in their life. For example, I lived abroad for 3 years, and so during those 3 years, I wasn't very involved in my brother's day-to-day life. I had my own, life going on in a foreign country and was very consumed in that. And so at that point in my life, it wasn't really possible that I was going to have more than weekly, FaceTime calls with my brother. But for my sister, that looked a little bit different, because my sister was living in the same town as my brother was, and my parents. And so she's able to play a lot more of that day-to-day role in his life. Whereas even still to this day, I'm not living in the same town or city as my family lives in. And it's also important to note that this ebbs and flows throughout the lifetime. For example, a sibling may have their own family and really at certain points may not be able to provide that same level of care to their sibling with a disability. And so I really just want to encourage families to have these conversations and to make sure that we're inviting siblings to the table, because a lot of times we're not being invited to the table, but also acknowledging that every sibling's different. Just because one family has, a sibling who's planning on building a house that's custom built to their siblings' needs so that way they can come live with them. And that's not every family. And so we want to play to everyone's strengths and preferences and ensure that we're never placing that role onto someone that doesn't want it. So when we're thinking about guardianship, I kind of briefly did mention this in the other slide, but we want to look at that circle of support and who from that circle of support can help your relative with their dreams. And this may be in a formal capacity, such as some form of guardianship, or this may be in an informal capacity. And we really kind of, as a family, want to have a lot of really frank conversations around who is helping them keep that dream, and what is your relative, who does your relative want to help them with their dream, and who is able to help support them with that dream. Yeah. You can take a couple seconds if you want to and kind of talk about that as a family. It's probably a much deeper conversation that needs to happen and continue to happen throughout the lifespan of the individual with a disability's life. So our final section we're going to cover today is finances. definitely when I do this presentation, the number one question I always get was, how do we pay for that? So we're hoping to kind of answer that question as well as we can.
It is important to plan for how you will pay for the things you need in the future. If you are using or may someday use government benefits, you should think about using a special needs trust or an ABLE account. Special needs trusts and ABLE accounts are tools that you and your family can use to save money to pay for things you need without endangering any public benefits you get, like SSI and Medicaid. You can use either a trust or an ABLE account, or you can use both. Special needs trusts are accounts that you or your family members can set up to purchase items that are not covered by SSI or Medicaid. Money in special needs trusts can pay for medical care, service animals, assistive technology devices, phones, computers, trips and activities, and car insurance. Paying for these expenses will not impact any money you get from the government. If you use a special needs trust to pay for basic living expenses like food and rent, then any money you get from SSI will be reduced. Trusts can be set up by an attorney working with you or your family members, or you can get an account with a pooled trust. If you and your family decide to set up a trust, it's important to find someone you trust to manage the money and pay for the things you need out of it. This person should know about state and federal laws, trust and tax laws, and the benefits you receive. These laws talk about certain rules you, your family, and your trust have to follow to make sure that your money is spent on things you need and doesn't endanger the benefits you receive. Pooled special needs trusts are run by nonprofit organizations, including some chapters of the ARC. These organizations manage the funds and use the money to pay for things a person with intellectual and developmental disabilities needs. ABLE accounts are savings accounts that help people with disabilities save money for disability-related expenses. These accounts are available for people who had a disability before they turned 26 and can provide proof of a disability diagnosis. There are many specific rules for these accounts. You can only have one account. You can only put so much money in the account each year. If you have more than $100,000 in the account, any money you get from SSI will be suspended until the balance of the account goes down. The money in these accounts can be spent for important things you need, including education, housing, transportation, employment training, personal care, financial management, basic living expenses, and legal expenses. If you and your family decide to set up an ABLE account, then make sure you either know how to manage your account or find someone you trust to help you manage the account and pay for things you need from the account. You or the person helping you should know the rules about the ABLE account and your benefits. Contact the Center for Future Planning to find out more information about ABLE accounts. Let's learn how others have used a trust or ABLE account in their lives.
I have a trust that's set up with the Arc of Indiana. I set the trust up so that it could help me pay for my transportation to get to and from work. And then I also set it up to help me with my bills that I had when I had an apartment. I go to the staff of the Arc of Indiana that run the master trust, and then I let them know what I'm needing and how much I'm needing and where and what I need it for. And then they let me know if I have enough in there to do what I'm asking for.
Choose a trustee that you really trust, that you have a really good relationship with and have for a long time, and that you will for the rest of your life or the rest of their life.
Special needs trusts and ABLE accounts can help you pay for things you need in the future. Find a person or professional you trust to help you establish a trust and/or an ABLE account. Manage the accounts. Make sure the accounts comply with the rules so that they don't impact the benefits you receive and help you get things you need.
Okay, sorry about all that. So just to kind of reiterate some of what they talked about, this is talking about ABLE accounts and special needs trusts. And so individuals with disabilities are, in the past, have not really been allowed to accrue wealth. So this would mean that they have to like spend down a lot of their SSI money that they may be receiving, because if they have more than $3,000 in the bank account, it can affect their SSI. And so ABLE accounts were set up, and they pretty much are a savings account for an individual with disabilities, and that savings account that doesn't impact their SSI. So this is where if they're working a job, they can help put some of this money in there. Their SSI payments can even go into here, but it does allow them to accrue wealth, which in the past wasn't allowed. So ABLE accounts can be signed up, the family member can sign up for them, very, very similar to just a normal savings account. And you can put up to $14,000 in there a year, and it doesn't affect SSI payments until you hit $100,000. That's a pretty big limit, and the earned income is tax-free. It is a little bit more broad as far as what the money can be spent on. It's called disability expenses, but it can be spent on a lot of just normal day-to-day stuff. Another option, and you can have both of these options if they're not, you don't have to have one or the other, but another option is a special needs trust. This is typically set up by parents or another family member for their loved one with a disability. And it usually is set up by an attorney. The ARC of Texas also has a master pool trust that can also be accessed. And so this is really good, especially if an individual with a disability is maybe going to receive some type of inheritance, or if they're listed maybe as receiving some type of like life insurance upon the death of someone. This can help. This ensures that pretty much that they don't lose those benefits. Also just a way for families to put away money for their loved one with a disability throughout their, starting when their loved one's young, and kind of helps be that saving account throughout their life. There's a little bit more rules on what can and cannot be distributed from a special needs trust. But once again, this is something I really would encourage you to reach out to some financial planners. GSN has contacts of financial planners who deal especially with families of people with disabilities, and so they know a lot of the ins and the outs of this system, and can really offer help and guidance on setting up ABLE accounts or special needs trusts. So that will be in our resource guide as well. Okay. Sorry. So what benefits might my relative be able to receive? In Texas, we have some different waiver programs. Some really common ones that you may have heard about are CLASS, MDCP, Medically Dependent Children's Program, HSC waivers. So these different waivers help provide caregivers, home modifications, they pay for group homes, they even pay for supplies such as adaptive devices, wheelchairs, even in-home adaptive devices, just a variety of different things. But in Texas, we have a very long wait list. Right now, the wait list for CLASS is you're looking at about 15 plus years. So they can be challenging to get on. So if you take nothing else away from this presentation, my takeaway is if your loved one is not on one of these Medicaid interest lists, you need to go get on it as soon as possible. Start the paperwork now because it really is a wait list. You just have to wait to move up that list. And once you get to the top, you can get these services, and these services pay for a lot of things. They can help pay for setting up that housing that we talked about, the renting an apartment and having like attendants who come into the apartment. It helps pay for that. It helps pay for group homes. It can help pay for a family member to take care of your loved one with a disability. They pay for a lot of things. There's really, really long wait times to get these services. So if your loved one hopefully is already on the wait list, if not, please do get them on as soon as possible and see if they qualify. SSI, Supplemental Social Security, it allows individual with disabilities to a monthly income that they can get that can help pay for a variety of things. They can get it starting at the age of 18 for sure, and then under the age of 18, there are some different stipulations. So definitely look into this benefit if it's not something that your loved one isn't receiving. Medicaid comes along with SSI and along with the waiver programs. It enables a loved one with a disability to have insurance. It is possible for people with disabilities to be double insured, so they can be on their parents' insurance and be on Medicaid, which would essentially ensure that there's no copays. Food stamps, you don't get a ton from them, but it is an option that can help an individual with disabilities pay for their food. Section 8 housing, like we mentioned before. Once again, long wait list, but it is a resource and an option for people with disabilities. Texas Workforce Commission can help with employment resources, job coaches, helping find a job. It can be a bit hit or miss, so definitely something to look into and then kind of see if they can help out your family. Like I mentioned before, a lot of these benefits do have wait lists associated with them, especially in Texas. Texas ranks 49th out of all the states as far as services people with disabilities. So we are pretty low down on that list. And there can be really, really long waits. So it's best to go ahead and to get on these lists, even if you aren't sure if you will utilize them. I was talking to a mom who came to one of my trainings back in February, and she was telling me that she got her daughter on the Medically Dependent Children's Program waitlist. And by the time her daughter came up, she no longer qualified because some of her qualifying health conditions had actually improved with age. She'd been on the waitlist for several years at that point. And so they weren't able to qualify, but they're still on another wait list for CLASS, and so they will eventually qualify for that one. So I think it's important, even if we're not sure whether or not someone's going to qualify, to go ahead and to get them on those interest lists, just so that way the services are there in case we need them. Which, once again, I think all of these topics are challenging to talk about because there is no one answer. A lot of it depends on your family and your family's needs. And what kind of resources your family can access. Okay, awesome. So moving forward, we've kind of been going through everything, and we do have this letter of intent that is in the back of your resource guide. And so if you pull up your participant guide, okay. So this is the letter of intent that I was talking about. And so this letter of intent is a roadmap that you get to have for your loved one with a disability. And so this roadmap, it should be something that if everyone in your family would have, for some reason, pass away tomorrow, another caregiver could come in, read through this letter of intent, and keep your family members' life as same as possible and ensure that they're reaching all those dreams and goals that we talked about. This is an important thing to discuss as a full family. My family meets once a year and sits down and talks through some different aspects of my brother's letter of intent, see what's changed, see what we need to add on to it, and see just where we're at looking forward. We do this, we keep my brother's letter of intent on a Google Drive, along with his current list of medications and doctors and copies of his insurance cards. And we do this because we are kind of spread out all over the US. I'm one of 5 siblings, like I mentioned, and so we are spread out over different cities because we're in different just parts of our lives right now. But this allows all of us to have access to it. And for example, this past December, my mom was recovering from surgery and my dad had the flu. And it was Friday night, and I went around Christmas time, and I was back home helping out. And I went to go put my brother into bed, and he had a fever. And so we ended up, and we couldn't get the fever down, so we ended up in the emergency room with him at night on Friday night. And the doctor asked me, who are his doctors? Who are his normal doctors? And I don't live in the same city as my brother, and so I don't attend his appointments. So I could tell you who his pediatrician was, but I couldn't tell you who his current neurologist was. I couldn't tell you the date of his last surgeries. I couldn't tell you a lot of those details. And so that really drilled home to my family the importance of keeping a lot of this information up to date, because if we had a Google Drive, if a Google Drive had been up to date, which it wasn't at the moment, my parents could have gone into their computers at home and shared me on the Google Drive, and then I would have been able to more effectively answer the doctor's questions, especially about his current medications and his dosages and who prescribed them. Luckily, we were able to handle my brother's flu at home, but it kind of drove home to us, like, stuff changes, and we never would have thought as a family that we would have been in that situation, because my parents are both very much healthy and alive, but it so happened that we were. And so as a family, we since then have been really working on keeping my brother's Google Drive up to date, with the same idea that we could share a caregiver on it if they were in the hospital, or share if something happened with whoever was the closest to him. So this letter of intent just it goes through a lot of the stuff that we talked about in this workshop that hopefully you've been able to talk about, or at least think about with your family as you've gone along. It goes through the basic contact information, and then also includes something that I think is really important, which is the story of the individual's life. The family story. A lot of times, sometimes individuals with disabilities can't communicate some of these more in-depth things. So it's really important for whoever's taking care of them to know their story, and to know where they came from, who they are, their family's hopes, their family's dreams, their family history. I know part is about those, we talked about that circle of support. You can go back in there and fill this in, and fill in, once again, thinking about those 2 innermost circles and seeing who's in those circles, because those are people that if something would happen, we would want a loved one to still have access to. We talk about family culture, what our family does, how do they celebrate holidays, birthdays, what are our different religious preferences, if those exist, spiritual preferences. Once again, talk about those strengths and preferences that we have kind of kept touching on throughout the presentation. We talk a little bit about what does a relative, how do they show if they're happy, how do they show if they're upset. This is what we do. We talk about communication, talk about habits and routines, talk about housing, what their current housing arrangement is, what they would like for their housing arrangements to be, what's important, what housing needs that they have, what choices they typically make, where they might need help in their personal care and their personal care routine, what they're able to do independently and what they still need help with. Food and eating, What are their preferences? What do they need help with? Any different food allergies would be good to note there. And once again, talking about post-secondary education and work, what does that look like for them? What's their recreation? What's their leisure? What do they do right now? And what would they like to do in the future? I like that, vacations, past one and future dream ones. Voting, library members, spiritual and religious needs. And then once again, who's the keeper of the dream? What doctors does our loved one see? What medication do they take? And this is where it would be pretty important to keep this up on like a Google Drive, because this may change. I also really like this section about doctors not to go to, because I don't know about you, but my family does have doctors that are in, we call it the Book of the Dead. Not allowed to go back there. You can kind of add in just different things that maybe if your loved one has any more unique medical needs, this might be a place to add it in. Education history, what are their needs, what's their financial plan, where's the will located, who has the information about the special needs trust, who has the backup information about all of this, stuff that we may not always think about that it is pretty important. Banking, what's the account number, paychecks, tax information. Yeah. So that letter of intent is something, it's really long and really tedious, as you can see, but it's something that is so important for every family to have. It's a roadmap. And this is not a stagnant piece of information. This is something we need to be constantly updating, at least every 6 months to a year, kind of thinking through what's changed, what's working, what's not working, what are we worried about, and what do we need to do moving forward. And so we've thrown a lot at you in these 3 videos. And so I just want you guys to all take a minute or so and just kind of think through what are your guys' next steps. So, I mean, realistically, you probably aren't going to sit down tonight and complete a whole letter of intent. That's not a realistic goal. But maybe a realistic goal is having a conversation at your guys' next family dinner about what the future looks like, or what do we think about housing options, what are different employment options. Really, when we're making these goals, I want you to think through what's really small and doable, and also prioritizing. For example, if your loved one is 17, we may need to be thinking about guardianship options sooner rather than later. Same with if they're not on any Medicaid waiver lists, those would be definitely bigger priority items that we would want to get done as compared to maybe thinking about employment or housing. Those are kind of more long-term things, where some of these things are immediate things that you can get done within the next 3 months. So just take a couple of minutes and write down just a couple of goals. I really think it's important when we're talking about future planning that we talk about it as a family, as a whole family, and make sure that everybody's on the same page. These are conversations that are very emotional and have a lot of emotional weight to them. And so they're important for us to think about, how do we have these conversations? I would say a lot of times it's better to schedule them in advance, so that way everybody knows that the conversation is going to happen and is able to come to the conversation in kind of a healthy place, having thought about it. I wouldn't probably necessarily recommend springing this on someone. A lot of times it can be helpful to do it around a meal, making sure that everybody's there who wants to be there, making sure that everyone's invited, even if there are, for example, maybe siblings that we don't really talk to very often, and they haven't expressed a desire in the past to be involved with their sibling with a disability. Keep inviting them, because like we mentioned before, life changes, life shifts, and we need to kind of be aware that we're always inviting people to the table. We need to make sure our loved one with a disability is there for sure, and that whatever we're talking about is broken down in a way that they can understand. Because we acknowledge that a lot of times, like I said, these conversations are hard. They're tough. They're tough to think about what life looks like when we're not there to care for our relative with a disability. But we really think that taking these steps, this letter of intent, this really helps ensure that we've thought through what life can look like for our loved one with a disability, and what they want and how that works for them moving forward. So this is the end of my presentation. If you guys ever need any more information about the Texas Sibling Network, please visit our website and feel free to contact me if you ever have any more questions or would like more information about anything that I talked about. Thank you for joining us for this presentation.